it's really clear that the system has to figure out a way to depopulate in a smart and coordinated way to reduce that risk inside. Brian, I'd like to shift over to you. Brian, I think that you can do something which will be very valuable to the folks tuning in by giving a snapshot or viewpoint into what healthcare is like in the corrections setting, because I think a lot of folks really don't have an idea about that. So can you start by telling us a bit about what the experience is like of being someone that is sick inside our correctional setting?
So again, having spent 2/3 of my life incarcerated and a vast majority of that time working directly in the medical unit, I've seen firsthand on a daily basis what happens. And I want to make this very clear that I'm not here to throw the nurses or the doctors under the bus, but the fact is that when there's nothing going on in the system, when there's not the flu that's running rampant on a regular day, they're overwhelmed and their resources are limited. So when something comes in, it spreads like wildfire, as you already mentioned. And they get so overwhelmed and they want to help, but they just can't because the resources aren't there. The obstacles and the barriers that they face on a daily basis, never mind when there's a pandemic, is crazy. So when someone gets sick inside, as Doc spoke to, and I'm sure a lot of people know, you have to write a request. Now, I'm sure at a time like this, maybe they're trying to see people a little bit faster, but they're limited. They can't do it. Like, they don't have the space. There's 2 infirmaries for men, one in MacDougall and one in Osborn. One's a level 4, one's a level 3. They have limited rooms and they have dorms there. So when someone gets sick and they believe that they have something that can spread, they sometimes will put them in a 0 pressure room. But you only have 3 0 pressure rooms in the state. So therefore you can't contain it. So as soon as someone comes up to an infirmary that is sick, everyone up there is getting it. It's just the facts. That endangers staff, that endangers those that are incarcerated. It puts greater people at risk. That if the CO who has to be there to directly take count, the nurses who have to deal with the individuals directly, the CNAs, the hospice volunteers, and then the other patients who already may be sick from something else are going to be susceptible to catching whatever this individual has. Once Corona enters, that's it, it's going. It's going worse than wildfire. And there's nothing they're going to be able to do to stop it unless they act now and do something in a safe, secure manner to reduce the population, to get those out that can go out. Because other than that, there's going to be major problems and people are going to die.